the Institute of Sports and Spines. Today we're doing part of our video podcast answering some questions that patients have. So we had a question from Natalie about a glut medius injury. Glut medius is a muscle that essentially goes from your hip and pelvis to the back of the leg bone, the femur, and it helps with external rotation of the hip and it helps with the tilting function of the pelvis. Now, it's a very commonly injured muscle but often misdiagnosed. So if someone has a labrum issue or a hip issue, as in they need a hip replacement, then the glut medius will be involved. If you have SI injuries, sacroiliac joint through here, the glut medius will have a role in managing or controlling what the hip and the SI joint will do. So injuries are very common. There's lots of different strategies that can be used to manage glut dysfunction, and commonly just soft tissue work, massage, different release techniques, sometimes acupuncture can be helpful. If they fail to have an impact, then you can move on to things like shockwave therapy and different more aggressive interventions beyond that would go to like injection therapies, cortisone injections, etc. Sometimes people have some surgery if it's become completely detached, have surgery to reattach the tendon, and certainly post-op rehab is a critical component in managing this, and as people get through the acute phase, then you want to re-strengthen the area again. So if something's been giving you a lot of trouble for a long period of time, say post-surgery, it can be applicable to get some more imaging done, work out whether that has actually had the benefit or the effect that the surgery is intended to do, or whether there's a secondary complication, because sometimes you'll have an injury that appears to have been resolved with surgery but something else has come up, or it's developed a tendonitis, or there may be a secondary tear or something that's developed. Sometimes there can be scar tissue or calcification that can occur, and that can stop a good resolution. So certainly if it's something that's still giving you trouble, it'd be good to give it a thorough examination and potentially look at some imaging to fully investigate and then work out a better treatment solution beyond that.